Hello my people, again it's Wilson. I want to welcome you to my YouTube channel, and this is where I bring healthcare related things so you can be able to see how people work in other world, especially those of us who live in the US. I want to take you a tour of just 5 minutes, and you are going to see a regular hospital room, how it looks like. I'm not talking about standard. There are people working in standard room or hospitals, so I've worked there, but I never had an opportunity to get that clip. But if I do, I will show you. It's just regular, what we always dream that our brothers, our governors can bring back to our countries, or especially to my county, Kisii County. Simbarati should watch this. It's a regular. If I was at Nyacheki, where I come from, this is what I could have loved to see. So join me as I walk you through this simple small room and see what it has. It makes you feel at home even when you are at hospital and your life is either ending. Okay? 2 things you need to know. When you come to hospital, we not only take care of your physical disease, we consider your emotional, your spiritual. So here we make sure that if you want a pastor or a clergy, is available. If you want to see a psych evaluation, they are available. Then we do other things as a standard. So when you get out, your spiritual, psychological, and the physical is really well taken care of. So welcome and see. If you see it's good, share with a friend. As I've always said, sharing is caring. Welcome. This is the main entrance right there. So when you walk in, we have a sanitizer right there. You sanitize yourself. You open the door, you walk in, you sanitize yourself. If you really want, there's a trash can. Then here you go around. If you see, that's the bathroom. When we get to the bathroom, or when, like, I can open so you can see the bathroom. Okay, so the bathroom is kind of dark, but I have my lights on. So this is just our regular bathroom. Regular bathroom, I will start with hand washing. Okay, when you want to wash your hand, that's where you wash your hand, before or after you take care of your patient. And this is the patient's room. This is the bathroom. These are the grab bars. Especially when you come to hospital, you're weak, you cannot be able to stand by yourself. So those are the grab bars that are there, you can hold. And if you see right here, this is a red pattern. It says pull for help. Okay, and you have been given a code here. So when you are seated on your bathroom right there, if you need help, you pull that button, somebody will be there to help you. So next to it is a shower. Okay, you're a patient, you come in and you feel like you want to take a shower. If you look here, this is pull for help. It's next to your shower. Okay, so this is your shower. You get in, you have grab bars around you can hold while you're taking a shower. If you get dizzy, at least you have something to hold on. And if you look at that, the light, I said it's next to you. And to take you back again, I said the toilet is right close to you. And if I go now, we're getting out. This is after using the bathroom. This is where you wash your hand. Your hand hygiene. I said the previous clip that hand washing is the #1 way of breaking infection, spreading of infection. So if you look here, it looks not too bad. So like I said, this is entrance. I've closed the toilet, and this is our regular room here, and that's the regular bed. That's where you come in, and this is where we will put you and you will spend most of your time at this bed until you get better. So at this bed, if you see, next to it we have a call light. This cord here is called a call light. So if you need help, if you press this button, okay, I want to show you good. If you press this button, you will see a red light right here. This will alert somebody who is outside that you need help. It's always kept close to the patient. That's your bedside stand, and that's your table, bedside table. And we have your remote, and of course I'm going to show you where your remote, where your TV is. So that's the standard, just regular, not standard. This is your regular bed, and next to bed is just a little sink. It connects you to where you want to eat. Your next thing, you have your fridge, and on top you have your microwave. If I can open, if you want to microwave something, you can put it in there. And if you want to open your fridge, you can put some snacks you don't want them to get bad. So your microwave is on top and your fridge is there. See, this is next to your entrance door. After that, you can wash your hands right there. I can close this now. You can wash your hand, right? Antimicrobial soap is there. After washing your hand, you walk slowly. You put whatever you have on your bedside table. This is movable, okay? It's way high. You can press this button and bring it down if you want to your height, and that fits what you need. On top there you have a clock you can look at. Quick recovery, I just wrote that one down. Then around we have a chair next to your bed for your family to sit down and have a chat with you. And when you are in bed, we have a side reclining chair. If you feel tired in chair, you can sit on your reclining chair. And the reclining chair is good. Most of the time patients use them to watch news. From your reclining chair, you'll be looking at your TV is right there. So remember, I told you there's a remote. Right now we have news going on. Okay, like I said, your TV remote is just next to you, so you'll be watching your TV. If you like politics, you don't miss that. You make sure you have that news at your bedside. Then here we have a simple closet where you can hang your clothes, because most of the time we want you to be in nightgowns, or hospital gown, for us to easily be able to access any part of the body if there's an emergency. It's a good place to be, and we love to share with our families back home, because most of the time people ask us, why is healthcare so expensive in the US compared to back home, especially Kenya, where I come from? It's because sometimes the kind of environment you are given is expensive. We care for your spiritual, psychological, and physical health. So that's just a little standard. It's not too bad. If I go 360, you can see there. If I go 360, that's the toilet there, and that is the main entrance. Good. And if you see, every time you walk out, you have to sanitize before you walk out. Then you say bye to your patient with your call light within reach. And each time you come in, you have to write your name, who is the doctor on duty and who is the nurse on duty. I hope you enjoyed, and I hope this will give you kind of vision on how people we do things here in the US diaspora. This is just a basic hospital room. Thank you.